The truth of it is that software in healthcare is terrible and no one likes to use it. Everyone, doctors and patients alike, find it very, very cumbersome, super antiquated, and difficult to navigate and understand. And that should not be the case.
Welcome to the DNA of Things, where we explore how DNA, environment, and behavior shape human potential. This podcast is about unlocking what makes us who we are, biologically, mentally, socially, so we can create better health, stronger communities, and a brighter future. Today's guest is doing just that. Cameron Moulène, an entrepreneur and innovator, redefining personalized healthcare through AI-driven patient data integration and predictive health management. Originally recognized for his acting career in MTV's Happy Land, Hulu's A Teacher, and YouTube's Red's Foursome, Cameron transitioned into tech entrepreneurship, leveraging his expertise in logistics and AI and decentralized data systems. As the now CEO of AugiHealth, Cameron is leading efforts to build a patient-managed digital health record, a DHR, and AI-powered proactive care platform. Inspired by his personal journey navigating healthcare for his autistic son, he co-founded AugiHealth to bridge the gap between fragmented medical records, real-time health monitoring, and AI-driven precision medicine. In this conversation, we discuss why patients don't actually own their own medical data and how AI can help individuals take control of their health and what a future of proactive personalized healthcare might look like. If you've ever felt lost in the healthcare system, especially as a parent, this episode might change the way you think about your health forever.
Cam, it's great to have you on the DNA of Things today. Thank you so much for joining.
It's great to be here.
Now, we were connected because you were looking for DNA. So it seems you come to the right place since it's called the DNA of Things. But, it occurred to me very quickly that you are on a compelling adventure, mission, I should say. And what I wanted to do is take the time today to talk a little bit about AugiHealth to the extent that you can share.
Yep.
So, I'd love to center around that mission. Also, you have a very interesting origin story. Your, let's say, beginnings as an actor, beginnings in, entertainment.
Does every healthcare CEO not start out as an actor?
I know, right?
Unique.
Well, communication's important, right? Empathy is important. And I think that goes into learning your roles, right? Is wanting to see things from somebody else's point of view. So yeah, I think there is obviously something very interesting there, but more than that is the kind of personal, undertones here, or overtones, I would say. But walk us through how you came to Augie. Go as far back as you would like, and then let's start with let's get to what called this hero into existence. So
yeah,
you can. Yeah.
Well, to not go through it all started when I was 6, as I'm laying on my therapist's couch narrative. The long and the short of it for AugiHealth specifically is I was just transitioning out of my last company, which was more focused on decentralized IP ownership. And my son, August, was about 2 years old and was diagnosed on the spectrum. He had this significant speech delay. He didn't really speak very much. He had a significant regression, and at around 1.5. And I had the time and some resources where I said, I'm going to obviously make this my primary focus. This is the most important thing, the only important thing in my life. And so I got him seen by a team of amazing specialists in LA. There were some programs that were really integral in his development, like Kids Connect at Semmel's Neuroscience Institute at UCLA. And they were so effective because they had this multi-vector, multidisciplinary approach to tackling early intervention, where you had 9 different specialists working collectively, but also with the supervision of a care provider and a neuroscientist. And it was all very clinical in terms of how it was being analyzed and disseminated. Well, the moment he left that program, there was this significant regression again. And he had 9 different specialists, all using different EHRs, all using different platforms. No one could communicate. No one could get records from other places. And I found that to be horrifying, right? I couldn't even get some of his records as his father because they were in EMR systems that would not share digital copies. So I demanded all of his records. I took some matters into my own hand and I fine-tuned like my own model, trained it on the parameters that I wanted it to be trained on, fed it all of his medical research and data, and got a single protocol. And I shared that with all of his providers. And I said, I want you all to be on the same page. This is informed by everyone else's specialty and point of view. Long story short, within 6 months, he was very verbal, and now he's high functioning and about to start preschool next week. And so on the uptrend of that journey, I went to my friend Alex Rowland, who's an engineer at Google, and I kind of explained, it was actually, ironically, it was on a road trip for our fantasy football league. And I didn't know he was an engineer at Google. He didn't know that I had launched a couple tech and operations companies before. We got to talking and I had fine-tuned this model and some other models, and he was really interested in AI. And, we said, everyone has a horrible experience in healthcare. Everyone has something that is a proxy to, I can't navigate the software. I can't own my records. I don't know where to find my records. I don't feel like my doctor actually listens to me. I don't feel like I'm armed when I go into these conversations. So there are these very universal problems that we said it shouldn't be this way. Right. And we didn't know much. We were very ignorant, but had this ambition that we wanted to fix it because we saw the results in my own son. And over the course of now, I would say about 8 years of what we're calling the pilling stage, where we iterated on a bunch of different products that we ended up not wanting to build and testing out a bunch of different more protocol focused things, we landed on what is now going to be AugiHealth and have been building it for about 5 months consecutively with a team of incredible, hardworking, a very small team, but like incredible developers and some brilliant marketing and some seasoned people in healthcare for what is going to be this platform, which I'm happy to get into more, but that's kind of the origin story of it all.
And so how old is August now? How old's Augie now?
He just turned 5 in January.
Wow. Congratulations. Yeah. As a fellow dad, I'm on a similar journey, a little behind, you, but that was really what kind of compelled me to reach out because I am on this similar mission effectively of collecting and collating the health records before any emergency happens. Thank goodness I'm in a position to do that. And well, I think to have probably learned from, my own father's missteps in the health system and that journey of fragmentation or fragmented health records leading to I remember actually him, this was like 30 years ago, showing me his printed health records. Here are all my health records. This is going to be the future. Like, get your house in order kind of thing. And the digital age is coming and everything's going to be wireless. And so the future is coming. And now here we are. And so maybe just to spend a little bit of time on Augie to the extent that you can share, because you said, okay, well, he was on the spectrum and now he's not.
No, he's still very much on the spectrum. Just to be clear, it's not like our platform has autism isn't something that just goes away, right? So, and also our platform is not focused exclusively for autism. We really tried to generalize a lot of the universal problems. What happened is the ability to synthesize data, leveraging AI, gave us actionable protocol that radically improved care.
Gotcha.
It gave us the ability to really understand from all these different expertise what's actually going on with my kid, right? Because the speech pathologist had a very different opinion than the osteopath, had a very different opinion than the neuroscientist, had a very different opinion than a behavioral therapist. Well, if everyone's opinion could truly inform everyone else's, and there could be a unified front, team Augie, that's actually working on my and my son's behalf to implement care became exponentially more effective. And that is what we're trying to give to everyone, regardless of diagnoses or current state. Is we're not doctors. This platform is not a doctor, but what it is we should have your data be owned by you and work on your behalf to help you navigate your care and help your providers navigate your care. Because that's the other big thing, right? Doctors have a hard time finding your records. Doctors have a hard time understanding expertise that are outside of their purview.
Here's someone say hi here.
Hey,
on brand.
Beautiful, man. That's amazing.
He goes. Sorry.
No, I mean that's more or less it. So no, my son. Firstly, when you diagnose so early too, you never know. right? You really never know. I think that as far as early intervention went, we did the best possible job that we could without overwhelming a little person to arm him with lots of amazing speech support. And he's doing incredible now, so much so that he can go into preschool without an aid or intervention. You never know how things are going to go. But from my conversations with his specialists and also me watching my own son develop, what we're hopeful for is that, by the time he's 7 or 8, he will have shaken or moved a few degrees of separation away from what from what neurotypical people who are not exposed to autism would be like, oh, that is a explicitly autistic trait, right? Like you're someone who can assimilate into society really effectively, which is the goal, right? Like you just want to raise kids who are socially attractive and can excel in their lives. That was early on, my whole vision for my son was I was just like, I want him to have a girlfriend or a boyfriend, and I want him to go to prom, and I want him to be social, and I want him to go and be a productive member of society. And it seems like that is actually what might be in jeopardy when you're hearing that diagnosis at 2, because you have no idea. So I just went, so long as that's our North Star, I want to arm my kid with the best possible tools and assets to do that. And that's just, I think, what any parent would want.
Well, and each child, I'm stating the obvious, is, it's kind of N of 1, right? Like even for, let's just say very well characterized health states or diseases, there's a genetic component, there's an environmental component, and then there's a behavioral component. And then, as you say, as part of the environment is the care team that you've got access to. And, the one thing that...
Not the only thing you can control.
Right. Well, and then if you don't have the right information, it's effectively, garbage in, garbage out. And, I think about, I've talked to a lot of folks in the rare disease community, for example, right? And, the trouble there is, well, you may be 1 in 100,000, but here's the interesting thing. I think, I think at least 300 million people are affected with a rare disease.
Mm-hmm.
I want to say, and all of us are carriers to some extent or another. So it's like rare disease as a category, like a meta category itself, is ubiquitous. And just the challenges is that, how those things manifest symptomatically and how they're treated, are vastly different. But if you have the heuristic, if you have the first principles in place in terms of, something analogous to like Maslow's hierarchy of needs in terms of having your own data, training like having like a matters of a future, like, LLM specific for porphyria or specific for hypertrophic cardiomyopathy. But,
I imagine that future often and quite acutely in reference to AugiHealth.
Well, so that was my sense when we first started talking. So, so we have the now, which is you've been on way of developing this, at least in concept for, did you say 5 years?
No. Much less than that.
Well, I know you're practically building it the last 5 months, but in terms of your thinking about it, that this needs to be done.
About a year before that. So there was probably a year of a pilling phase where it wasn't passive and 2 guys sitting around, thinking about how to best. We were testing different frameworks and what we thought were most effective, both for acute situations and also just like the general population and what benefits people and doctors and that relationship, which is vital. And I like what you were just talking about from a heuristic standpoint, because the reason I reference Kids Connect at Semel, which is where my son was very fortunate to get to go. It's really, really hard, long wait list to get into that program. And the reason he went is because I called them every day as a persistent parent and just demanded that they take him, right? Like just every single day until finally the head of the program called me and goes, Mr. Moulène, this has been a lot. And I go, yeah, it's just my kid. Of course it has.
Mm-hmm.
Neither here nor there, but I reference it because I saw the difference between when you have a truly systematized and clinical understanding of every different vector of care, looking at an individual as an individual, as opposed to this very fragmented system that everyone else is experiencing in the healthcare landscape. Most of us do not get to go to an isolated program for 12 weeks where 12 specialists are looking at you and working collectively with a care team to really understand what is going on. That doesn't exist. So what we're trying to do is essentially offer a bridge whereby leveraging multiple LLMs in a 40 model constellation system that we've built out, we can take all of these fragmented data points, often siloed data points that you don't own, and really empower you to leverage them to your benefit. So that's the idea, is like, how do we recreate something that feels so much smarter than what everyone is experiencing today, and then just arm everyone with that, so that when they go into their PCP, they go, hey, listen, here's what all of this is saying. You should look at my smart record. And if the PCP goes, well, I'd like to check the source data, well, let's make that readily available for them too, because you trust your physician, and they should get access to that if you want them to have it.
Mm-hmm. Mm-hmm. Yeah, it reminds me of Lisa Selberg. I had her on the show a while back. So she's the founder of the Hypertrophic Cardiomyopathy Foundation. So she's a survivor, had a heart transplant. I mean, I think she worked in like human resources, but just was compelled to make this her mission. Lost her father, lost her sister. And, we talked at length about, HCM. And, one of the things that she said is it's not just like black and white HCM. And even if we look down to the DNA, it's not your traditional or conventional Mendelian genetics, and it's not just HCM. It's possibly also anything else. It's drug allergies. It's, vulnerability or susceptibility to Alzheimer's disease. And, we're looking at an incomplete picture of the human. And well, she was right, because just a few weeks ago, there was an article published, basically looking at over a million plus markers considered an apologenic risk score for HCM specifically, which, I mean, before maybe they were looking at tens, maybe 100. Mm-hmm. It's like, whoa, wow, okay, well, now we've got a much, more concise picture by broadening and looking at, I think it was like tens of thousands of affected individuals, or even more than that. But that automatically gets plugged in to the centers of excellence, which she started to build. So there's a digital component, but then there's also like a physical component where the standard of care is delivered probably through something like what you're building. Like, I don't think she's built it yet. So I've got to make sure you guys chat. But, the fact is that, it's like, there's this one vulnerability that you may have, but then there are all these other things that would affect your journey and your care. And, I like the other point too, and maybe we can spend a little bit of time here, this idea of care teams. So I've worked a lot with, high performing athletes, professional athletes, and guess what? They get injured or they need to be optimized. And there's a lot of cooks in the kitchen, right? You mentioned osteo, sure. There's massage, there's chiropractic, there's surgeons, there's dietitians, there's your technical coach, there's your team coach. And it's like, okay, well, there's your agent. How is everybody looking at the same athlete and having the same picture, so that, when a trade deal comes up, or when an optimal surgery or an imminent surgery comes up, like, how is that all managed appropriately in light of this individual? So what I'm interested in is, obviously there's a high tech element that you've built out. I'm interested in the high touch side of it, because I think you mentioned 40 different models, and there's probably people that need to connect to and use this. And have you had any interaction with care teams at this point? And if so, what is their reaction? And if not, do you have a plan to engage such a community?
No and yes would be the most blunt, honest answer. Look, we do have clinical purview and insights into how we're building these things. We have a bunch of doctors as advisors. Yeah. Dr. Mike Roizen, who runs concierge medicine at Cleveland Clinic, is now a co-founder of AugiHealth, and I've spoken to him extensively about best practices in terms of the framework. But no, I say yes because, like I mentioned earlier, we have no interest at AugiHealth today, or even for the foreseeable future, to do any kind of usurpation of the doctor-patient relationship or the doctor-provider relationship, whichever provider you're using, right? I think that human connection is vital. I think expertise and bedside manner is necessary in the medical landscape. Can you foresee a future where you have highly trained AI models that are focused on protocols for each of those elements? Like, you have an AI model for your nutrition, you have an AI model for your physiotherapy, you have an AI model for your stretching, an AI model for your workout routine. Yeah, absolutely. We already have beta versions of all that stuff, but that's not good enough yet. That's not human yet. And it's not, even informed by everything else, the implementation and the adoption for a user is not something I would want to use yet, right? Because I would much rather have a coach that I have a personal relationship with, who I trust, that I'm building progress with. And that kind of touches on how we've built our application. Like, the truth of it is that software in healthcare is terrible and no one likes to use it. Everyone, doctors and patients alike, find it very, very cumbersome, super antiquated, and difficult to navigate and understand. And that should not be the case. So one of our North Stars from a UI UX perspective was, let's take this incredible tool that we're building that is stratifying and synthesizing complex data and make it so simple that a 12-year-old could navigate this app and really understand what's going on and really understand our suggestions for protocol, why we're suggesting that. And beyond that too, make sure that providers are getting an amazing profile that has this synthesized data that they can really understand and that they feel empowered is going to improve proactive care in their patients. So we will have two core sides of the AugiHealth platform at launch. It'll be, I suppose beta will have just the Passport. Passport is your ability to come on as a user. We will make calls to all of the health exchanges on your behalf. You can upload any relevant medical records yourself, link any wearable data, any wearable like your Oura Ring, your Apple, all agnostic to that. Take whatever you want, your Peloton bike. And then you'll be able to do daily questionnaires for mental wellness as well. All of that is cross-pollinated. You are then given your smart profile, completely free to reuse. Then there's Augie Care, where users can assign provider status to any doctor on the NPI list or anyone else that they want to make an emergency contact, who can then access that care profile. And on an admin view, they're given essentially a stoplight system, which notifies doctors on how you're hitting your goals metrics and your biometrics in terms of progress, but also like risk factors. So we're giving a lot of predictive analysis so that doctors can intervene preemptively, as opposed to the sick care system that specifically in the United States, I think ubiquitously we feel we're dealing with, right? Where it's much more about, now I'm sick, I'll go see my doctor, as opposed to, I'd like to not be getting this sick. Maybe a doctor could intervene early and let me know that I'm off course.
Yeah.
So that's really our vision, is to arm doctors with a toolkit where, just as easily as we want people to understand their health, we want doctors to be able to be proactive and do what the promise is, which is keep people well.
Mm. Well, I tell you, your 15-minute bookings would become much more effective, wouldn't they, if the data was available at a touch stroke, right? Because that's typically what like meeting with your GP is 15-minute bookings, right? But
that's exactly right.
Yeah.
Imagine if your doctor didn't have to scramble for records, wasn't fighting to make some like personal, independent understanding of everything that's going on.
Yeah.
Then trying to be cool with you and be personable and talk to you. Instead, let's skip right to, no, I know everything about this person. I have been able to track them myself for the last 6 months because they're just in my database and the repo is giving me real-time feedback on everything that's going on. So when I sit down with Jeremy, he's someone who I care about as my patient, and I'm just here to see how I can help. And
Right.
what are my insights as a professional, as a medical professional, based on all this data that I didn't have to fight to get access to.
Yeah.
So that's exactly right. It's
Right.
like, let's make the most of those 15 minutes.
Right. Like, what are the human cues that I can pick up on as your human provider that the data collection device isn't necessarily getting? And so there's that high tech, high touch confluence. And then that's true for, well, every single care provider, right? I think this is, kind of preaching the choir to whoever's listening. Like, if I just walk through my day in the life for the year, it's like, well, who am I dealing with? I got my dentist, I've got my physio post-op, I've got my ortho, I've got my GP, I've got my ear, nose, and throat doc, I've got my eye doc. And yeah, so, right now our daughter, Brooke, she just has a pediatrician and a GP. But that's just going to slowly expand, right? Like right now, I'm kind of operating as that data control center. Like one of the things that I knew is that she had a predisposition for, congenital hearing loss, right? So one of the first things I ordered was, let's check the hearing test. So, okay, well, it turned out to be fine. But if that wasn't the case, we would have got, the implants earlier, to coincide with social development, let's say. But it would, wouldn't that be great if you had the reminders and you had a dashboard? Like, I think about, how much time we spend on like financial planning, right? Like what are my
Mhm.
goals, and what is the are my investments diversified appropriately? It's like, well, are you going to be alive to even spend this money? Like, what is kind of the metric that we might be looking at in terms of, well, health span? Like how far does your health span go? And we can start to, probably even build those, predictors so that, when the rudder changes a little bit, you're like, hey, you just kind of lost 10 years of health span there from, those.
It's funny having this conversation with you because you have not gotten to see the beta of the app, but that is one of the key indicators on your smart profile is what's your estimated death date.
Yeah.
It's kind of a bleak, morbid metric. However, when you're empowering the user with a bunch of predictive analysis with forecasts around, hey, these 3 or 4 micro behavior change with the compound interest of 4 or 5 years of consistency, you're adding 10 years of your life. And not just 10 years, you're adding 10 years of wellness into your life as well.
Right. That's
exactly how we're looking at it. It's a longevity and wellness app, despite it being free for users, because democratizing healthcare ownership is important. It's a value that means a lot to us as a company. We're looking at this as we'd like people to be using this for a long time. This is like, it really is about what Robinhood was able to do for finance. You mentioned finance, and I think that it's such a great idea. Is like they really simplified these abstract concepts like compound interest for the retail investor. They gamified it and they made it really easy to understand that, like, oh yeah, these like small daily investments really do add up over time. Same thing, same principle for what we're trying to do with healthcare is that it's not fun, it's not sexy, but hey, walk for 20 minutes every day. Hey, try to eat whole foods, not processed foods. Those basic things, right? Get enough sleep. There's a core 6, right? Areas. When you're hitting those metrics, your general wellness is so radically improved that your longevity is affected dramatically. And that's a foundational element to our whole app is really wellness and longevity.
Do you see, like, so on the one hand, what's interesting to me is, like, as a dad, is I want to, as you say, maximize the years of health span. And one of the things that I'm looking at is, analogous to the profit loss, I'm looking at the chronological to biological age ratio, right? As something that I might be able to control. So if I'm 40, fine. Is my biological age 20? Can I move toward that?
Yeah.
Right. So what models do I, so there's that, there's like for the parent, but then there's also like for the child, like, well, what are these food choices that we're making? Where do we live? Exposure to environmental contaminants. Like how do you imagine those things are those risk factors? I mean, I think anything is.
Look, it's kind of one of those things where it's a rabbit hole, right?
Right.
You could get so unbelievably granular especially when you're dealing with like environmental factors.
Right.
And why wouldn't we as we scale? I think that they're all relevant and they all should be considered. However, there's another approach where, in the same spirit of trying to make this really easy to understand for people without diluting any of our like deep analysis that we don't brush over. Your everyday, I'm a firm believer that people are tired of living on their phones, and people are tired of always having to reference different applications for improved benefits in real world experiences. And so while I do think engagement on a daily basis with our app via the questionnaires and via check-ins is vital, I want to minimize that as much as possible to maximize your real world experience. So I don't want to be building something that fosters tremendous anxiety for people, where they are constantly needing to check in on all of these different levels that are quite often out of their control, right? A lot of these environmental elements, like, listen, here's the best example, Brian Johnson. I think that guy is really interesting. I've gotten to have a call with him, and we had a really thoughtful conversation about what each of us was building and how there might be parallels or opportunities. And he is clearly a brilliant guy. And his investment in understanding all of the biometrics and all of the environmental factors in his life and maximizing everything, awesome. Incredible data. The fact that you're open sourcing it to people, really cool too. I use his products. I use Blueprint. That is not a realistic strategy for your everyday person. Most people are figuring out their 9 to 5, and then they want to spend time with their family, and then they're dreaming and aspiring to like make the most of their free time so that they enjoy those relationships, so that they can maybe go on a vacation this year, so that they can do the things that matter truly in life, which is those human relationships. And so we're trying to be an application that in no way deters or removes the value of that. In fact, we just want to be a background support to enhance the things that actually matter in life. We're not trying to make everybody a biohacker.
Right.
We're trying to empower everyone with a really powerful toolkit so that you don't have to do a lot of that heavy lifting. And are you going to get all the same data that Brian Johnson is? No. But do you want to spend $2 million a year? Most of us can't, myself included. So that's just, I think that's important for our company is going, listen, because it's about democratization. It's why the app is free. I could very easily slap a $10.99 subscription on our app, and I think it would be a steal for most people given the services that we give. That's not how we want to monetize. That's not how we want to grow. I think everyone should get this because it will help everyone, and it's a better business. It's better for people to make it free. So the same idea is like, it's not realistic.
Right. Well, so I think you beat me too, because where I was effectively going to go is like, that's the one thing that I care about as a dad is being around longer, right?
Totally.
To provide and to,
it's a horrifying thought when you leave this world and you leave your kid in it. It's a
right.
Sit with it for a second. It's not, yeah.
Yeah. So, you get wrapped up into the, okay, well, I make up this much money and got this tuition fee and, health insurance, it's like, okay, but also you need to be around, right? For as long as possible. And so then where I was going to jump to is, I think I shared with you on our last call, I was like, I would love it. It's funny you chose the name, the age 12, is if, by the time Brooke's 12 years old, she has like a PhD in her own body, right? Like things that most people don't know today. Like I had, a friend works at a private school, reach out to me and said, hey, can you come in and do a workshop on nutrition? I was a professor in my former life. I taught nutrigenomics, and I'm just kind of blown away that like that's even a need in a discussion, but it is. And so, okay, well, how do I do the first thing first, which is, navigating those small choices day in, day out in the home. And again, like creating that, that knowledge center, for that growth and for that understanding. And again, like, here's the objective measure of, all things relevant to, you, Brooke, and your optimization for your chosen goal in life. And here are the risks. Here's where the quicksand is. Here are the drug allergies that you have. You don't need to experiment to find that out. So where I'm going at, and then obviously my wife is, dialed in. She's a holistic nutritionist. So, I've got like the kind of, it's funny. I remember this was when I was really young and stupid, like, 18. I was all into genetics back then. I'm like, I'm not going to have any children unless I can genetically modify them. And like, okay, what do you think? You know what I mean? Then you see your child born and you're like, wow, like I could have never done that. And anyway, I like really loved, molecular.
How we think we're gods when we're young.
Yeah. Yeah. And Kristen had more of like, again, holistic nutritionist because her dad got sick and she was seeing that, he had blood cancer, and she was just seeing that his response to the treatment, obviously you don't want it at all, but it could be improved by taking care of this nutrition component, which was just never discussed. And so anyway, she really brings those day-to-day practices into the home, and I'm thinking about things in a technical frame. And so we have this nice little, family, unfair advantage to be sure, that where we really care about this, and we see this as, well, it was one of my objectives as soon as Brooke was born, is what is our family health operating system, right? And right now it's just a bunch of, it's an Excel sheet and some folders, right? But like, how do I pull it up and be like, boom. And that possibility is coming. Like, I have a pharmacogenetics report, for example, and I can interrogate it with AI such that when I had surgery on my knee recently and I met with the anesthesiologist, and, he said, hey, do you have any drug allergies? And my running joke is, I don't know. I haven't tried them all. And, but the truth is your genetics can tell you where those vulnerabilities are. And I said, okay, well, I asked what should I ask? What should I tell my anesthesiologist, my predispositions, pharmacogenetics, based on this treatment plan. And well, the one thing that was flagged is like, oh, you're a negative responder to Celebrex. And that was part of my outpatient protocol. So it's like, okay, great. Take Celebrex off. What were we using it for? Inflammation. Okay, we'll give you Benadryl if you need it. Don't necessarily need to take it. But that was like in action, in the moment, right data, right time, right action.
Incredible. Yeah, that's amazing. See, those are the kind of seemingly unimportant nuances that can so radically optimize a person's care program.
Right. And so, again, I have this unfair advantage. I've been thinking about DNA for 25 years and, my wife, nutrition for, 15 years. And so we have this, very proactive and reactive way of looking at health. But so we want to optimize that in our own home. And then it's like, okay, well, all the families in our neighborhood, like, how do we work with them? And, it's funny because I started to think about this, and it's like the BRCA1, BRCA2 breast cancer screen, which I know you've come across. It was actually in large part influenced or accelerated the discovery because of the Mormon population. And so the Mormon population in Salt Lake City, I believe, like, they had to take really good records, right? Because it's a smaller gene pool, right? But because you have that family information in the context of where the disease is manifesting, the genetic insight is, I think it's 100x more informative versus like the population genetics that we're doing with 23andMe or All of Us or whatever. So, but previously it's like, okay, well, so in the Mormon population, or you go back even, further, when basically the Bible was like where you would keep your family records, right? Or your family history. That's what I'm going for. And basically, I think where I understand the potential for Augie and August, don't let me put words in your mouth, is, well, so here's the thing, like, you go and you meet a new care provider, the first thing they'll ask you is, what's your medical history, and what's your family history. The family history is broad. It doesn't discern between genetics, the behavior, or the environment. Like, Kristen's dad would have got blood cancer. Why? Because of his genetics? Probably more so because of exposure with the military. We can't confirm. But when we look at our DNA, we don't see the vulnerabilities there. But you see, that's a very different conversation versus, well, okay, you have a history of, and then Jeremy, by the way, on your side, heart disease. It's like, okay, well, here are the genetic risks, but here are also the behavioral exacerbations as a result. So it's a very powerful paradigm upgrade. And, for it to be something that is like, we talk about this on holidays, we talk about this every quarter, we make New Year's resolutions based on it. We might plan our week based on it, right? Here's how we're going to do our grocery shopping, right? And so yeah, I'm excited for how this becomes integrated into, the household where there are children. So and given its origin, Augie, your son, like, is that the launch pad? Like, are you focused on families, or do you have some other beachhead that you're thinking about?
I think families, something like 85% of medical records, this is specifically in the United States, are managed by mothers.
Exactly. Yeah.
So we did not miss that statistic in how we've been thinking about it. And yes, given my personal story and I think the real value, that's a huge component. Beta will launch for individuals because, we're just still a small, by the way, I have not taken $1 of VC money to build this thing. We put our own money into it. We built it as well as a team of incredible devs who are much more competent than me. We're able to work under myself and my co-founder, Alex, to get this vision to life. And then got to bring on Mike, which was extraordinary good fortune, and we're thrilled. And some amazing advisors too. But yeah, families is going to be a huge component. That's the future, right? And our whole company is focused on the future. But I think that if there's one big paradigm shift that I'm focused on at Augie, is it's ownership. I think everything boils back down to ownership, because despite people not knowing this, again, I know you're in Canada, this is specific to the United States, and I think Canada's system is a little better in this respect. You own your medical records. They're yours. It's your data. You just don't know where to get them. And they're intentionally siloed. And the reason is, the hard truth is that at every single stage of data siloing or gatekeeping, there is a monetization that happens. And it's generally on the billing platforms, the big companies that you know the names of. And that is deeply problematic. And so what we're trying to do is reframe that entire paradigm and say, you should own your records. And in fact, we'd like to arm you with a tool that helps you make sense of them and helps you really get a unified front so that when you go and navigate the world at large, but specifically your relationship with the providers you trust who are giving you true medical advice, you have all of the data that could possibly inform the decisions that you're going to make for your families, your loved ones' health plans and health decisions. And I think it all comes back to ownership because it's meaningful. It's not just meaningful because you're getting all of this predictive analysis and this powerful data. It's meaningful because it gives people real agency, right? And today, I think that most people in the United States, my experience and everyone who I spoke to when building this company was that people don't feel they have agency in their health plans or in their healthcare treatment or in their journey at all. They're at the whim of whatever doctor they're meeting, and they hope that they find a doctor that they like, and they hope that they find a doctor that listens. And then you're at then you're dealing with the other components, which is what's the third leading cause of death in the United States? Malpractice.
That's malpractice, sure. Yeah.
Yep.
Yeah.
And by the way, that's not a dig against doctors, right? I would say 99.9% of doctors have very good intentions and are doing their absolute best, but they're also just people, just like all of us.
Right.
And the more data you can arm people with, the more information you can give people, the better, in our opinion. So that's what we're trying to do.
Yeah, you mentioned the agency and the owning your own data. So will AugiHealth, will that offer storage as well as analysis, or do you imagine leveraging some other kind of decentralized storage system like the blockchain on top of that? Where
we've explored it, I have mixed feelings about the blockchain.
Yeah,
Listen, our data is stored with HIPAA best practices, encrypted on both ends. No PHI ever goes into any of the LLMs. We're very, very cautious about how we're moving your data and how we're storing your data. So it's probably, along with ownership, the most important thing, right? Because it's your health data. We should keep it secure for you. We also strongly encourage that you download, once you've unified everything and you have it there, you should download it and keep it yourself. We make it easy for you to download a PDF of your health record and all of your synthesized records that you've shared with us so that you then own it on your own, can't call it cold storage, but warm storage so that you have it readily available.
Yeah.
And that you link an emergency contact so that if anything ever happens to you, they have access to that record as well. We make it streamlined in terms of how you move that data, who you share it with, and who you revoke access to. But yeah, absolutely. We're a full repository in that sense that's encrypted and secure. Yeah, I mean, it's just, to me, it's one of those things where you do a little diligence on why this hasn't happened yet. And financial interest aside, we learned that there are lots of big companies who have tried this. And the one prohibitive element is people are a little more reticent to trust a huge tech company with their health data, as they should be. But Google Health was a huge attempt at this in 2005. They went about it in a very different way, trying to build a true EHR. We're a software provider where we don't claim to be EHR. We also not claim to give you medical. They did not have the empowerment of AI to truly synthesize data. They didn't have the Cures Act of 2016 and TEFCA of 2021 that made all these health exchanges required federally through legislation to make their data interoperable via API to share said data back with the individual. So the landscape has changed such that it's given us a great entry point and an opportunity to do this. But we're not the first people to think of this. There have been well-intentioned people, I'd imagine, who have tried to do something similar.
Right.
I think we're just we have a good window to really take a swing at it.
Like my dad, who printed off all his health records. Yeah.
By the way, and we encourage people to do that. I don't know if they need to be printed necessarily, but you should be able to, once you've unified everything and provided that to us, take it, keep it on our app. If you want, we'd love to make it really easy for you to navigate your care, and we'd love to continue to give you real-time feedback and predictive analysis, but you should take it and own it off our servers and off our repo too, because it's yours. And I don't think you're going to find a single other healthcare company that suggests that. I think that's pretty indicative.
Right. So Cam, when is Augie going live?
The platform will be fully built in April, early April. And then we will kind of do our beta testing around. We'll give early access to users to really get some feedback. And then I think, early this year, we will have a hard launch, and we're excited to see what comes of it.
Yeah. Do you have any goals with the first launch, or is it kind of a, hypothesis outcome kind of launch, kind of soft goals?
Yeah, we've got plenty of business goals. We believe that we're providing an extraordinary service for no cost to the consumer.
Mm.
And so we hope that there is rapid adoption.
Mm-hmm. Cool. So when we started chatting at the beginning, I asked you 3 questions that I said I'd revisit at the end. And we've kind of, I think, talked around all these things, but it's always good to kind of, hit it on the nose. So in terms of our conversation today, what's the one key thing that you would like to communicate? And I guess it goes along with number 2 is who needs to hear it?
I'll speak specifically to the United States population because that's who we're launching for.
Mm-hmm.
You own your health data. You should own your health data. And you should feel empowered to take some agency over that ownership. And that is vital for your wellness and your loved one's wellness. And we hope to be a part of that agency for you, empowering people to really own it, really understand it, and really then be able to navigate their life with having that powerful tool as a background, not something that we want to be in the forefront of your mind.
Mm-hmm.
It's something that you have total control and self-direction around.
Amazing. So you answered 2 as well. That's basically everybody in America, all 300 plus million of them there. Your healthcare
Big audience.
Yeah, yeah. And then the third question was, who would you nominate to be on the show next?
Judy Faulkner.
Okay. Any particular reason why?
She's a hero of mine. I think what she's built is extraordinary. And I think that consistently over 40 years, she's been the smartest person in the room.
Mm.
And I think that our companies are very different in our perspective. But if you could get one guest who I think could give you incredible insights into health, genetics, and where the landscape is going, I think Judy Faulkner would be a great guest.
All right. We'll put her on the list. Well, thank you.
Listen, if you can get a conversation with Judy, you're doing something right.
Now go for it. We're going to go for it. Well, we've been blessed to have some amazing people on the show. Actually, I had Jo Handelsman recently. She was actually the former chief scientific advisor to the Obama administration. She's the person who pioneered metagenomics, which is basically the DNA sequence of everything. So yeah, I will take that as a mission from you to explore that end.
I will watch that episode in full.
Okay. Okay. In the meantime, Cam, how do people find you, learn more about Augie? Where should they go?
We are, depending on when this launches, but we're at AugiHealth on every social platform.
Okay.
Our website is augihealth.com.
Mm-hmm.
You can sign up for our wait list today.
Awesome.
And we'll be granting, probably 10,000 people or so early access to test everything out pretty soon.
Amazing. We'll make all of that information readily available in the show.
And they will enjoy the incredible in-home sequencing kits, most likely.
We'll see. Yeah. Yeah. I'm excited to get your feedback on those. Stay tuned for more. Yeah. Awesome. Okay. Well, Cam, thank you so much for being so generous with your time. I know you're busy. You're on a life's mission here. So we really appreciate hearing from you, and we'll be watching and following and cheering and looking for what's next.
Thanks, Trevor. No, it was my pleasure. It was a great conversation.
All right. So join me in thanking this incredible conversation with Cameron Moulène, a father turned healthcare entrepreneur who is reimagining how we manage our medical data. Today, we learned that the biggest barrier to better healthcare isn't medicine, it's access to the right information. The future of personalized health isn't just about AI, it's about empowering you to take control. In this episode, or if this episode sparked something in you, please do share it with a friend or perhaps a parent or anyone who has ever struggled to get the care they need. So let's join this movement of patient-owned health. Thanks for listening, and we'll see you next time.